A long-term study found changes in your vision could be an early indication of dementia. Researchers gave more than 8,600 people a visual sensitivity test. Years later, participants who were slower to see visual differences were diagnosed with dementia. Of the participants, more than 500 developed dementia. I want to bring in for more Dr. Scott Grossman from NYU Langone Health. Dr. Grossman, thank you so much for joining us. So can you explain exactly what this test is finding and how it relates, if that has been found yet, to a person's risk of developing dementia?
Yes, thanks so much for having me on. There were a couple of different tests that were looked at in the study. One of them, which you just showed pictures of on the screen there, is something called the Mules test, which is a test of rapid automatized naming, where people are asked to look a series of objects and name them as fast as they can. And this test is coupled with a similar test that looks at numbers called the Sun test, in which folks are asked to name numbers as fast as they can. And we're looking at these tests because vision is such an important part of our brain. We use about 50% of our brain for vision. And the theory is that we can use tests like this that examine vision to help us with early diagnosis of dementia.
So I'm curious. I think one important thing that I'm wondering about is why is it important? And it might be obvious, but I'm not sure about what treatments there are for dementia. So A, is this consistent for all types of dementia? And how does it help to detect it earlier? Are there good treatments out there for it?
Thanks so much for that question. We're living in a really exciting time when it comes to diagnosis and potential treatment of dementia. And viewers may be aware that there are early medications that have recently become approved as infusions for dementia. And when we talk about dementia, there are actually a lot of different kinds, including Alzheimer's disease and a precursor to Alzheimer's disease, mild cognitive impairment. Some of these dementias are approaching a place where treatment may be more of an option than others,
Mm.
and we're keeping a close eye as treatments become more available for all kinds of dementia.
And how much time before was this given, or when should people start doing these tests? How soon?
That's an excellent question. We always want to be able to measure someone's baseline with these tests,
Yeah.
because what we measure is the baseline time to completion. And at a certain time point in the future, we can measure the time to completion of the same test down the line. So the option may exist in the future to have tests like this, these tests of rapid automatized naming, or the Mules test that was shown earlier, be done as part of a routine screening in the office of a primary care doctor or a gerontologist who may be seeing patients prior to development of any symptoms that could be concerning for dementia.
And just from what we know, before I let you go, are there any risk factors, or are there any lifestyle changes that are recommended for people to avoid being at higher risk?
Yes, and if it's really important to start thinking about these things early, because things like vascular risk factors, hypertension, cholesterol, and physical activity can be important considerations for risk and development over time. For many kinds of dementia, there are both lifestyle as well as genetic risks. And it's important to be thinking about these things early on in life or in midlife to ensure that dementia is as preventable as it can be as we move forward toward our later years.
Super helpful. Thank you so much for all of that advice, Dr. Grossman. Appreciate it.
Thanks so much for having me on.